test here, and I've never done one by myself. Do you think you could come with me and help me?
Yeah, of course.
Perfect.
Always remember, the most important thing is to make sure you correctly identify your patient. You do that with the two patient identifiers, their name and their date of birth.
Okay.
Okay?
Good morning. My name is Taryn, and I have Carlos here with me. We're going to take a quick chest x-ray if that's okay.
Yep.
Perfect. Can you tell me your name and your date of birth, please?
Brooke Peasy, June 10th, 1999.
Perfect. I'm just going to check your bracelet, make sure everything matches up. Okay.
We want to make sure that you move everything out of your way, like the patient's table, so you have enough space to work with, and then remove any artifacts that might appear in the image, including any jewelry or patient's clothing that will show up on the x-ray.
Okay. I'm just going to take your table away for this picture. And I'm going to move your phone too, okay?
Okay.
And then do you have any necklaces on that I can't see?
Yes.
All right, are you able to take those off for me?
Are you able to help me?
Of course. I'm going to put that right over here on the table so we don't lose it.
Now for the portable chest x-ray, we want to sit the patient up as much as possible to get an erect image. So
Okay.
go ahead.
I'm going to sit you up a little bit, okay?
Okay.
Good. Are you able to scoop back in the bed as much as you can?
Yeah.
Perfect.
Alright, so for the board, you want to make sure you put a bag on it so you don't damage the cassette. And you want to ask her if she can sit forward, move her pillow out the way, and then place the board with a little bit of space above her shoulders.
Okay. All right, ma'am. Are you able to lean forward for me?
Yes.
All right. I'm going to take your pillow, and then I have to put a cold, hard board behind your back. All right. Go ahead and lean back for me. Good.
Do you have your markers?
I do.
Okay. You want to make sure you put the markers on the correct laterality and make sure it's not obstructing any anatomy that would be in the image. The proper positioning for this one, you want to make sure the CR is perpendicular to the board. You want to make sure she has her arms out of her way and her chin is elevated. And you want the CR perpendicular to T7. You want to make sure you shield your patient.
Put this on your lap.
Then you're going to give her the breathing instructions, so you can come here. You want her to take a full inspiration, blow all that air out. She's going to take another full inspiration in and hold it there.
Okay. All right, Miss Peasy, I need you to take a deep breath in, blow all of that air out, take another deep breath in, and hold that breath.
The structures shown on a portable one-view chest x-ray include the entirety of both lung fields, from the apices to the hemidiaphragms and the costophrenic angles of both sides. The heart shadow and the aortic arc are also visualized, as well as the trachea, some of the ribs, and other bony anatomy. Our image is acceptable if both lung apices and costophrenic angles are visualized, with the apices being projected slightly over the clavicles. 8 to 9 posterior ribs should be visible, indicating sufficient inspiration. Rotation should be kept to a minimum, and exposure indicators should be in range.
Once we achieve our desired images, you want to make sure you leave the room how you found it when you came in.
Okay. Take this shield back from you. I'm going to have you lean forward. I'll take this board out too. Put your pillow back. Are you okay sitting up like this, or do you want to lean back down?
Can you lay me back down a little bit?
Okay, tell me when it's good.
That's good.
I'm going to have you take this from me. Okay? I hope you feel better.
Thank you. Wow, those x-ray techs really know what they're doing. Hey, what do you got there?
It's a one-view chest on a 5-month-old, and I've never done one. Do you think you can help me?
Yeah, let's go.
Perfect. Hi there, are you Dad?
Yes,
Hi, we've been ordered to do an x-ray on your son. Is that okay?
that's okay.
Perfect. Can you tell me his name and his birthday, please?
His name is Carlos Correas. His birthday is November 18th, 2025.
Perfect. I'm just going to check his wristband really fast.
Okay.
Okay.
Important thing to note when you're doing a pediatric patient, you always want to make sure that they're lying flat on the IR. They usually put a barrier in between, like a warm blanket. This will help bring comfort to the baby. We want patient cooperation, so if you can, we're going to bring them into the exam and have them help hold during our imaging. And then always remember the shield because pediatrics are the most radiosensitive. As you're placing the baby on the IR, just make sure that there's no buttons or snaps on their clothing. If there is, we're going to remove them so that it's out of the way of the anatomy. And then you're going to place the gonadal shielding on the patient. So always make sure that if you're having a parent hold for you, that they are equally protected. So we have lead on the dad. Dad's going to hold the arms above the head to help make sure that the patient doesn't squirm during the imaging. Always remember that your tube is perpendicular with the board, that you're collimating to the area of interest, making sure that the shield is not included, that you're adding the proper marker on the correct anatomical side of the patient, and that with assistance from the parents, they are holding the patient's limbs out of the area when we're being x-rayed. Always remember that with pediatric patients, especially this young in age, that there's no real breathing instructions because they can't follow them. So if they're crying, that would be ideal. You would take it in on a deep cry to get more air in their lungs. However, right now our baby is doing great. So what you're going to do is just watch the breathing and take it when you see them take a deep breath in. And we're going to follow Laura by taking 6 feet back while Dad is holding the patient.
The criteria used to evaluate the image are inclusion of full lung fields, airway, visibility of peripheral lung markings, rotation, inspiration, cardiac silhouette, the mediastinum, and the bony structures. Special considerations for pediatric chest imaging include factoring in motion, collimation, and technique. The radiation field on the collimator should include earlobes to approximately 4 centimeters above the umbilicus. The central ray should be at the level of T6, T7 like an adult patient, and arms should be raised above the head to limit motion and avoid obstructing relevant anatomy.